Hi, I'm Dr. Raymond Douglas, Beverly Hills, California, and I'm an orbital and oculoplastic surgeon. So many of my patients ask me what an orbital decompression is like and what the recovery is like. Well, I do several hundred of these surgeries per year, and no two surgeries are exactly alike, but there are a lot of principles and concepts that I can give you and give to my patients for expectations on what the recovery is like. First of all, the surgery, you come in and go home the same day. The surgery lasts between 1 and 2.5 hours, depending upon what we're trying to achieve. Typically, we'll have had a long discussion regarding what type of surgery, how much surgery is going to be done, so that everyone is on the same page coming the day of surgery. After that, once the surgery is completed, most patients have a little bit of white foam tape under their cheek, and they'll start to have some bruising and swelling setting in as early as that evening. Now, frankly, most patients look a lot worse than they feel. Most of the time, pain is not usually a big issue with this surgery. In fact, if someone's in a lot of pain after surgery, I would want to know about it, and all my patients get my personal cell phone number because I want to know about any issue that may arise. But typically, there's a lot of swelling and some bruising setting in, but not a lot of pain. There can be numbness, especially the first day, because we give some injections that really kind of dull the pain and make that a lot better. And this numbness can last even for several days or weeks after surgery, but almost always goes away. The little white tape underneath the eye after surgery is to reduce the bruising and swelling, and it really helps for the first 4 days or so while it's on to reduce and get rid of the future bruising and swelling and really aid the recovery process. We want you to be back doing things as quickly as possible. So for the first night, it's just kind of relaxing and a little bit of ice back in the hotel or back at home, making sure that everything is going well and that you're checking your vision just to make sure there are no issues or no problems going on. The next day or two is typically taking it easy. Walking around is fine, but no major exercise, and you're really not going to feel like doing a lot. Again, there can be some numbness. The swelling can even cause the eye to look droopy and to get rather bulging, and the eye can get rather bruised at this point in time, but this goes away pretty quickly. Again, ice for the first 48 hours and no Advil, aspirin, anything like that, any non-steroidal, because that would really increase the bruising. Over the next days to 2 weeks, can gradually increase what you do as far as exercise, walking, and within 2 weeks everyone can resume largely their normal activities, normal exercise pattern. During the first several days of 2 weeks, I ask you to do eye exercises, looking all the way one way, the other way, up and down. This really helps to get the eyes moving and reduce any chance of double vision during this time. Double vision is the biggest problem that sometimes we deal with during the surgery, and it can happen in a couple % of people. But the most important thing is get the eyes moving and really try to reduce the inflammation as much as possible during this time, and that really helps to improve the double vision. So overall, you can get back to doing things, getting back to work even within a week, but taking it easy, lots of ice, and usually you look a little bit worse than you feel during this time. For more information, please see our website and subscribe to our YouTube channel. Thank you so much.